Hi, I'm Dr. Schalit. I'm a board-certified maxillofacial surgeon specializing in facial cosmetics. I've been serving both Volusia and Flagler County for almost 20 years. I've been a member of the American Academy of Cosmetic Surgery and board-certified by the American Board of Oral and Maxillofacial Surgery. As recently, I'm proud to accept it as a fellow of the American College of Surgeons. I serve as Chief of the Division of Maxillofacial Surgery at Halifax Medical Center in Daytona Beach, and serve as an adjunct professor at Nova University, where I train chief residents in facial cosmetic surgery each year. I've trained over 30 residents in the past 10 years. My background allows me to perform a wide range of facial cosmetic surgeries, from brow lifts, face and neck lifts, mid-face lifts, rhinoplasties, eyelid surgery, and lip lifts to facial trauma to complete skin rejuvenation. These procedures can all be performed here at Florida Oral and Facial Surgery in our Health Boulevard Surgery Suite. Our state licensed surgery center allows us to perform a wide variety of facial cosmetic surgeries right here without having to go to the hospital. This allows us and our staff not only provide a financial benefit to our patients, but to provide a high level of quality care and service to all of our patients. As a national trainer and speaker for Allergan Cosmetics, I'm able to perform the latest in surgical treatments for facial rejuvenation. I perform over 3,000 patients a year in both Botox and fillers. This includes things like Botox, dermal fillers like Juvederm, Volbella, Voluma, Sculptra, and Kybella. Let's take a closer look at some of these procedures. Kybella is deoxycholic acid. It's an acid that's actually made in our body. It's been created to destroy fat cells beneath your skin. It may be a good option for you for the area in the submental area underneath the chin. Kybella is not only an acid that occurs naturally that's substance in the body, but it's also FDA approved to break down fat cells in the submental area, making your face appear slimmer. The product is injected with small needles to the jawline and the submental area for contour. Incredible results can be achieved with 2 to 3 injection treatments around 6 weeks apart. Hi everyone, I'm Dr. Schalit here today, and I'm here with one of not only my friend for 20 years, but also my partner, and just recently a patient of mine, Dr. John Akers. And we're going to talk to John a little bit about his experience. He came to me and I was really honored and felt awful gracious. He came to me to talk that he was ready to do some cosmetic surgery for himself. And so John, being a surgeon himself, I felt really honored that he chose me to do that as my partner and as his friend. So we're going to talk a little bit about today about his experience, about his what it was like for him to make that decision to do so. So everybody, this is John Akers. So John, tell me what made you finally decide, hey, I'm ready to do this?
You know, you reach a point in your life where everything looks the same and it's actually looking worse and worse each day. And I have an older brother and people would frequently mistake me for being his older brother. And I decided I'd had enough. And at that point I thought, maybe it's time to go ahead and get fixed.
Yeah. When John came to me, we talked about it. We sat down to kind of devise a treatment plan, and John kind of talked a little bit about the things that bothered him. So up on the screen, we have a little bit about John's before picture. And John is an avid hunter and fisherman. He's out in the sun a lot. He's lived in Florida his whole life. So these are some areas of sun damage we talked about, some of the lines around the eyes and mouth. And the treatment plan we devised for John, we did laser for his skin. We did a mid-face lift to put his cheek pads up, and then we did a face neck lift, and then we addressed his eyes. And you can see his before and after. I think it took 15, 20 years off John. So tell me a little bit about the experience. How was it from, being a doctor all the time, but how was it being a patient?
It's great to be a patient because now you know how people feel. And but let me back up just a little. My father looks just like me, or I look just like him, and he had probably 100 basal cell carcinomas, and I have a lot of them that I know were beginning to show up, and I was glad to get the laser treatment because I feel like it just totally gave me a fresh new start. Yeah. So cancer prevention was one of the main things I was looking for. Not to mention the fact that I had a double chin, and not to mention the fact I have all these fine wrinkles, and then I was not able to see too well when I looked up because my eyelids were so baggy. And that's the things that I was looking for. Now, you may remember you did my wife as well.
I did, that's true.
And you had such a profound effect on her that, you know, if she did well,
John,
I probably should do
you sit her
well.
in first.
So put her in first.
That was a good thing, good thinking. So how was it from a post-operative course? I mean, was it painful? Was it difficult? Tell me what your thoughts were.
It really was not painful. I think that we had discussed that the hardest thing was sleeping on my back. Because that's kind of necessary the first few days. But I had wonderful support from the office, and I don't think it was just because I work here. I think they do that for everyone.
Right.
Phone calls from Sylvia, you know, the estheticians that saw me the next day, changed my dressings. They did so much for me that all I had to do was just heal.
Right.
And that's all that it took.
You know, doing facial cosmetic surgery, one of the amazing things about being able to do that is having a surgery center, that this is our staff. We get to control who we hire, who we don't, so we get the best of the best. We're able to do it in an environment outside the hospital where there's sick people and there's infections and things. So these elective procedures, to do those in our office, to be able to have the facilities here that we built to do that, it makes the experience better, and it allows us to control the variables that we want to, whereas in the hospital sometimes we don't get to control who your nurse is or who your follow-up care is, and having our staff here makes a huge difference.
I think the estheticians are phenomenal. I have to say that. They really took care of me.
Yeah, they do a great job with that, because there is some care afterwards. So, you know, after these procedures, and this is John from a frontal view, but you can see laterally when you look at, and this is what happens with our time, our loss of our jawline. For John, a lot of the sun damage he talked about, which was important to him. I mean, look how great his skin looks. So if we don't do the laser and we just do the procedures, then it looks good, but it doesn't look great. And so to be able to knock out some of these actinic areas and early basal cells and get fresh new skin in there and tighten up that skin, people I think underestimate and don't realize that benefit from it. There's some washing and there's a little bit of work to those first couple of days, but you know, I think from a surgical standpoint it's worth it, and I think you probably feel the same way.
Oh, I feel really worth it. I mean, I see people all the time that they look at you, and they look at you, and then they finally just say, "You really look good. You know, you've been taking care of yourself." And
Right.
I say, "Yeah, it's just good genes."
You know, the best thing about surgery for me, I never want my patient like they had surgery. I want you to look good. You know, if you look like you had surgery, I always tell people it's either bad surgery or maybe too many surgeries. So, and I think for men, it's still a little taboo in some areas they feel like that. So, you know, I think for guys to be able to see us a little bit and say, hey, you know, he did it. He looks great doing it. It's very natural. I think men get nervous, and sometimes women, because you see some things on TV that are like, wow, that person had surgery. It's real important for me as a surgeon and for you as a patient to really feel like it looks natural, and that is just you with the clock turned back, you know, 10 or 15 years.
I've never had anybody say that, wow, you had surgery. You know, everybody just looks at me like, boy, you really, what's up? You know, you look different.
Well, listen, your result was great. I was so pleased how it came out. You know, John, like I said, none of the skin, but his eyes, when you have that heavy lid skin, to take that away, I'm going to need it soon myself, and I'm going to have John do it for me. That's coming up next for me. But I think for men, you know, again, it's becoming more and more people going back in the workplace. We're working longer, we're healthier, we're living longer, staying longer, working longer, and to try to go for job interviews, I think it's important those guys don't feel like, hey, they're not hiring me because I look too old, or I don't fit the part. So that tends to be my patient population more with men, that, hey, I'm in the workforce longer, I want to look and feel my very best, and this is a great opportunity to be able to do that.
Well, it certainly has been that way for me.
Yeah.
I've enjoyed it, every minute of it.
Yeah. Well, listen,
I take care of my skin better than I used to.
Yeah, it's amazing now, right? All of a sudden you got products you're putting on our skin, right?
Maybe I better take care of it.
Right. Well, that's important. I think as guys, we don't think about that, but I tell everyone, skincare, we overlook as surgeons because we're busy doing the big surgery stuff, but what do we look at on people? Their skin. That's the first thing we see. And if your skin doesn't look great, then, you know, we ask ourselves what's the problem. But once we take care of it and see what we can do with it, I mean, we all live in Florida. It's a great place to be a facial cosmetic surgeon in Florida. Everybody has sun damage, but we have so many great ways to treat that now to give people a fresher, younger look, but then importantly, get them on a good skincare regimen. So you can see the difference and how good your skin even continues to look better even from there, how great it looks now.
Yeah, it really has stayed well.
It looks good. It looks
Yeah.
good. All right, well, listen, I want to thank you for coming out today, and for sharing a little bit with everybody as far as your experience, and honored as you're not only your friend and partner for 20 years, but allowed to be your surgeon as well. If any of you guys are interested, men, women, or anybody to have facial cosmetic surgery, feel free to go to drschalit.com and come in and see us at Florida Oral and Facial Surgery. If you are bothered by fine lines and facial wrinkles to the forehead and lateral eyes, deep lines around the mouth, or tired of looking tired, Botox and fillers may be a right solution for you. As we start to age, hyaluronic acid, which is a natural substance in our body, and we make less as we get older. Hyaluronic acid is a sugar molecule that's part of our collagen makeup, and as we get older, we make less of it, causing the skin to lose its elasticity. This decreases, causing the skin to lose its volume. Juvederm can restore lost volume, which can allow us to achieve a more youthful and younger, yet a natural looking appearance. The treatment is tailored to your specific needs. The treatment only lasts 5 to 10 minutes with little or no downtime and immediate results. Botox treatment for both men and women can eliminate crow's feet and the forehead lines, with results showing in 3 to 7 days, reaching maximum benefit in around 14 days and lasting 3 to 4 months. Let's talk about Cool Sculpting. It's the #1 FDA cleared device that is revolutionary treatment, uses controlled cooling to destroy fat cells in stubborn areas that are difficult to treat with diet and exercise alone. This non-invasive treatment uses special applicators placed in the specific body areas to freeze unwanted fat cells, which are then naturally removed as your body metabolizes them. With little to no downtime, you can boost your self-confidence and feel comfortable in your own skin. Laser skin resurfacing. This can help resolve issues of fine lines and wrinkles, uneven pigmentation, and other imperfections that can take away your self-confidence. We offer different types of lasers, including the IPL, the erbium laser, the BBL, our hair and vein laser, and multiple other modalities to help depending on your skin's needs, all leaving you with fresh, smoother, more youthful looking complexions. Hi everybody, this is Dr. Kurt Schalit here at Florida Oral and Facial Surgery. I want to welcome everybody today. I have one of my favorite patients, Shannon, who we did surgery on. How long has it been now?
May 13th.
May 13th, and she came in for a consultation. The things she didn't like her nose and some of the puffiness under her eyes. So we talked a little about doing what's called a rhinoplasty to correct her dorsal hump and a little bit of deviation she had in her nose, and also the areas around the eyes of the blepharoplasty. So Shannon, tell me a little bit about when you're thinking about having surgery, what are the things that made you finally say, hey, I'm ready to do this?
I think just because I'm getting older and it wasn't getting any better. Right. Yeah, I think that, I broke my nose when I was younger, and it was just, I was noticing that the older I got, I think your nose doesn't stop growing, and I just thought, it's the best time.
Yeah. So when you're looking into choosing a surgeon and choosing a facility and choosing a place, what are some things that you looked? How did you find out about us?
Okay, well, I found out about you specifically from the dermatologist that I've been going to for years here in Palm Coast, and then I have a really good friend who actually had rhinoplasty with you, and so I had like 2 perfect reviews.
Good.
One from a doctor and one from a patient.
That's good, that's good.
Yeah.
Because I do think it's important for patients to do their research. I think when you're doing elective procedures, I always tell all my patients, do your research, meet the doctor, meet his staff, the facilities, all those are important in making, it's a big decision, it's your face and it needs to be right. So tell me about, walk us through a little bit about after surgery was done, do you remember the day we took the splint off?
Yes. Like 7 days.
Yeah.
Day 7, and it was very emotional for me.
Yes.
And I didn't think I was going to get emotional about it, but I did. I could tell I could breathe better already, and my profile was amazing. And it was surprising to me because you hear that it's going to be months before you finally get the final outcome. Right. But that part of it was almost immediate. Yes, the swelling went down, but you told me that I was seeing a good part of what it was going to look like already. So it was amazing. I cried. It was ridiculous.
It was exciting. Listen, as a surgeon, nothing makes me happier than when my patients are happy. And I think a rhinoplasty is such a it's such a procedure that's one of the more difficult procedures in the sense if you look at people that are unhappy with their nose and not happy with their surgical results. So it's always good for me when we take that splint off to have a mirror and to be able to see my patients, see the reactions and how that makes them happy. Tell me a little bit about, for just people who don't know, how was the pain? How was the post-operative course as far as your two procedures you had?
As far as the rhinoplasty goes, there wasn't a whole lot of pain. I don't even think I took any of the pain pills, honestly. The worst part of the eyes was the laser,
right.
And that was just like, you know, maybe like a sunburn. Mm-hmm. And the staff and you as well, just told me exactly what to do. Right. I read the paperwork before, and I had all my stuff that I needed to get, the creams, and it was, because I had such good education prior with your staff, I just did everything I was supposed to do.
You were a good patient. So a little bit up here, so I want to show her photos real quick. You know, her profile, how awesome. She had a little bit, again, this dorsal hump, and from her trauma, she did have asymmetry in her nose. The left side was collapsed, which collapsed your septum, and that's why your breathing was bad. So we took out part of the septum, we used it to make a little graft on the tip and to rotate the nose up a little bit. And this is just the nose she was supposed to have. It's a softer slope, but it's still her nose. I don't want it to be some cutesy nose. Shannon's face is a longer, and she has a great jawline, and I think her symmetry now is so much nicer. The lid skin, and if you look at her three-quarter picture there, how much softer that made her face, and the profile she has now from her nose to lip to chin is just, she's got such beautiful eyes, and now you can really focus on those. So I think that just, that came out awesome for her. Okay, well listen, for those people thinking about having surgery, what are your recommendations to them as far as doing it?
I think that they need to come for the consultation because you have all these thoughts in your head, and you might surf the internet and you might do all those things, but until you actually come in and talk to you and the staff and get comfortable. When I left here after the consultation, I had wished I would have come a few years ago because it wasn't immediate. I felt comfortable. Not only because of the people I had to talk to prior, but you made me comfortable. The staff is amazing, and they made me comfortable. And so it was a no-brainer after I left. Yeah.
Listen, I tell all my patients to always seek another consult because I tell them all, you're going to come back to us because my staff is better than everybody else's.
And they are.
Yeah, they're great.
They are.
So listen, I want to thank you a lot. For those of you that may be interested in rhinoplastic surgery or other surgical options, please feel free to come see us at Florida Oral and Facial and ask for Dr. Schalit. Seminars. Here at Florida Oral and Facial Surgical Associates, we offer monthly cosmetic seminars where many questions concerning these surgical and non-surgical procedures can be answered. Questions such as, am I a good candidate? How are the procedures performed? And what is my downtime? These seminars are informative and interactive, showing before and after photos of our cases, to help you learn more about different techniques used in facial cosmetics and what treatment may be best for you. Ultherapy is designed to lift and tone the skin of the face and neck through the use of energy ultrasound and stimulating collagen regeneration. It is the only FDA-approved treatment available to help resolve sagging skin in the neck and jowls without surgery. The length of treatment will depend on your particular need and can last anywhere from 60 to 90 minutes. To see if this procedure is right for you, take the next step and contact our office for more information. Microneedling with PRP. The revolutionary treatment of microneedling with PRP, or platelet-rich plasma, is a way to treat and improve the skin's tone, texture, reduce pore size, and diminish fine lines and wrinkles. Microneedling activates the reparative cells to regenerate collagen and elastin, which are essential components for beautiful, radiant skin. The PRP works by drawing 60 cc's of blood from our arms once we're asleep or when we're in the room for the microneedling. Platelet-rich plasma is a use for platelets in our body. There are multiple growth factors. There's at least 12 of them we know, from platelet-derived growth factor to tissue growth factor. These growth factors allow our skin to repair. So basically create a bionic reparative wound that's able to be placed back in our skin. And this stimulates our collagen growth, stimulates our reparative. We have less swelling, less bruising. I even use it in all of my facelift patients as well to help speed up healing. I think our patients look better at a week than most patients look at 3 weeks due to the extensive use of technology with PRP. The microneedling together with PRP can significantly improve sun damage, hyperpigmentation, acne scarring to help you achieve the skin you've always wanted. The best way to find out more information is to go to our website at drschalit.com. There you can find out all the information you need about me and the practice.